So Nellie, this is a companion to your Axios case. So here's my Axios. And it's going into this discrete walled-off necrosis. So this patient, you can see their pancreas actually looked like it's enhancing pretty normally. So sometimes, people ask me like, oh, how can this be necrotizing pancreatitis if the pancreas is enhancing pretty normally? And a lot of necrotizing pancreatitis is actually peripancreatic fat necrosis. So you don't have to see necrosis of the pancreas itself to know that this is the sequela of necrotizing pancreatitis with extensive peripancreatic fat necrosis. And probably when it's this extensive, there's a leak. There's an ongoing pancreatic duct leak. So this had been going on for a couple of months, and you can actually see that there's these rim-enhancing extensive collections bilaterally. It has a lot of gas in it, which is one of the signs we get alarmed that this is infected. However, because we have our Axios stent in place, the air could just be from the debridements that they've been doing. And in this case, this actually was dissecting through the abdominal wall into the groin here.
That's so crazy.
Really severe necrotizing pancreatitis. And so I asked my gastroenterologist, like, when do they use the Axios? When do they do this kind of debridement? And he said, if you have a well walled off collection, so it has to have a nice rim to it because they don't want to, put their scope in and start debriding and then kind of end up dangerously out of the collection. And then if there's a big component that's adjacent to the stomach. But in this case, where you've got all this retroperitoneal necrosis as well, you really need to have a combination approach. So eventually we did what we probably should have done initially, which is also put in some very large drains bilaterally. So we put these drains in. So for walled-off necrosis, we'll use 14 or 16 French drains. And you might even want to put several of them. We were actually planning to put one into the abdominal wall down here, but actually it fistulized to the skin and the pancreatic juices were coming out of the skin, so we didn't have to put the drain in that subcutaneous component at this point. And then often what happens is that our surgeons will use our drains to do a necrosectomy. So they'll use them to kind of know the anatomy and do a video-assisted retroperitoneal debridement along the course of our drains. So that's what they did here. You can see actually the patient has a bunch of free air. That could have been from the G-tube that was placed or from the debridement that just happened. And then you can see that the collections have decreased significantly, and now we have these surgical drains in place in the same location that we had our retroperitoneal pigtail drains. And one more teaching point is that you should always try to stay retroperitoneal if possible. So even if your collection looks like accessible from the anterior approach, you don't want to try to drag those pancreatic juices across the peritoneal cavity anteriorly. So if possible, you should try to stay retroperitoneal like this. So just a couple of teaching points. So we have the Atlanta classification for pancreatitis. So we break it into, there's either interstitial pancreatitis or necrotizing pancreatitis. And as I said, it can be either involving the pancreas or often peripancreatic. In the first 4 weeks, you can get an acute collection or an acute necrotic collection. And then after 4 weeks, we call it a pseudocyst or walled-off necrosis. The main difference is that a pseudocyst, you don't really need to do anything about. You can just leave it unless it's very symptomatic. Whereas walled-off necrosis often indicates that there's ongoing pancreatic duct leak or severe necrosis. And so that's when we would use this. Basically, you want to do a combined approach. So you would do an endoscopic drain if it was next to the stomach. You'd put in these large retroperitoneal drains, and eventually your surgeon can do your video-assisted retroperitoneal debridement.
Cool case.